Dr. DeCubellis here. A question I get asked quite a bit from people is, what does a treatment plan look like in your office? And this is a great question because the treatment that we do in our office is very different than what most chiros do, what most PTs do, what most other offices do. Because of the way that we not only do the initial exam, we get a more specific diagnosis. We look for things that others just don't even know how to look for. And because of that, our treatments are a little bit different. So the way that we devise our treatment is our goal is to not only get people out of pain, but to make sure we have proper movement and functionality of the areas that are involved so the pain doesn't come back. So what does that mean? Well, we're going to utilize things like adjustments, physical therapy, physiotherapy, different kinds of balance training, biomechanical movement patterns. The goal is, again, to get you moving pain-free. So the first thing that we would do in a treatment plan is we're going to do things like adjustments. That gets the joint motion back, which is one of the 3 ranges of motion. And we need to have joint motion because that's what's going to allow the muscles to function properly. Next thing we're going to do is we're going to do some vibration massage. This not only helps muscles relax, so when we have muscle spasms, we can get them to loosen up. It also breaks down scar tissue. We can't have scar tissue stay in the muscles, otherwise we get some permanency and some bad things happen, and you're more likely to have accidents, injuries, or traumas in the future. We're also going to potentially use electrical muscle stim. Electrical muscle stim is going to not only help relax the muscles, but also break down scar tissue as well. We are going to either use a hot or a cold pack. The goal is that if we have inflammation in the area, we're going to use ice to help not only get the inflammation to go away, but to stop the spread of it. If we don't have inflammation, or if we're after 3 days of post-injury, then we're going to be using heat. Heat is going to increase tissue circulation, promote tissue healing, so we want blood flow to and from the area. Next thing that we utilize here is going to be some neuromuscular reeducation, basically retraining your body to move properly. So we do this a couple different ways. First thing is we have these specific wobble chairs. What's really cool about them is the center, or the fulcrum, or the thing that you pivot over, is the size of the center of your disc. So we get the most spinal movement possible without overstretching muscles, tendons, or ligaments. We also utilize things like balance balls, balance boards, wobble boards. This way we can work on not only that neuromuscular reeducation, but balance training too. Because we want to train your body to be strong enough to keep your normal balance, not the old way that you were moving in the compensatory mode. We're also going to utilize something like whole body vertical vibration. Now this is really cool because we have these vibration plates you stand on. It vibrates up and down, which loads and unloads your joints rapidly, which promotes not only healing of those joints, but it's also sending that vibration through the muscles, which helps them relax again, which is what we want. Then we also want to help loosen things up and get you to hold the right kind of positions with your spine, so we use traction. Now the way we do traction, we don't use any weights, there's no machines, there's no hanging over the door. We use the normal weight of your body help to restore those curves, so there's no risk of injury from the way that we do it. There's also other options, things like ultrasound. We utilize home stretches. We do P&F stretching in the office. It's a stretching against resistance that increases flexibility, range of motion, even further than what you can do on your own. And then we also work on postural strengthening. So now that we've got you moving the right way, we strengthen you up to stay that way. So as you can see, we've got lots of different options. The goal is that we set up a treatment plan that's going to utilize the best of those specifically for what's going on with you to get you the best results in the quickest amount of time, but also the results that will last, not ones that are just going to last for 2 or 3 months and come back. So that's how the treatments work in our office. Any questions, you can give us a call, or if you'd like to set up an appointment, you can do that as well.